But that said, for me, the the documented stuff that's available, obviously the higher blood sugar stuff is what we're all trying to avoid. I think we'd all agree, and I think a lot of type ones that end up exercising either exercised before or started to exercise to manage their diabetes. And that's why it's so important. That's why
A lot of hospitals are using 3.6 as their hypo now, not 4.
it is.
I said a lot of hospitals are using 3.6 as their hypo, not
Makes
4
sense, yeah.
now.
Yeah, that makes sense.
So, we were taught 4's the floor, but that was before we had CGM and closed loop. So, like UCL in London, University College Hospital London, that are quite a big centre that are well renowned, they use 3.6 to 7.8 as their range.
Right, okay.
So 4, unless it's 4 and double arrow down, that's a bit different, isn't it?
Yeah, of course, yeah.
A steady 4, they don't call a hypo and they don't treat, which I've kind of try and follow that. Not always, not if I'm driving or exercising, but if I'm sat around, I try and use that as my hypo rather than a 4. I'm not saying everybody else should, because everyone's different. But
of course, yeah. Well, I've always found, for me personally, like if you can nail your overnight, like as in if you can get a really nice tight line in the low 4s overnight, that's a big chunk of the day, isn't it? But it depends how long you sleep. But I mean, it could be, if you're like Wendy and you sleep 10 hours, then that could be 10 hours, right? Right. So I always say to people, if you can get that bit, I mean, that's it, even if you have 8 hours, that's a third of the day.
I've just had a brilliant thought.
Go on.
We could all go into work and just say that on medical grounds, we need to sleep more. So we need to come into work late, because if we can put our closed loop on and sleep for longer, we'll have a better time in range.